Shereen, and I'm a doctor working here. I completed my Masters of Medicine from Pacific Eye Institute. When I was working at Nandi Hospital, I realized that we had lots of patients coming with eye problem, and whenever I had to refer them to an ophthalmologist, I found out that we didn't have any ophthalmologist in the Western Division. And then when I called Suva, we didn't have any trained ophthalmologist in the Central Division either, and leave alone North as well. They still don't have a trained ophthalmologist. So I thought that this thing needs to be looked into, because people are going blind and the quality of life is reducing, and they are not taking care of themselves, and there are many other public health concerns, medical issues that's going up, because they cannot take care of themselves, they cannot see which medication to do, they cannot check their body and see that they are having ulcers, sores, and the quality of life is going down, down, and down. So I thought, I applied for ophthalmology, and then thanks to Pacific Eye Institute, when they walked in, they came in with all their textbooks and with all the resources, and we could actually know, wow, there's so much. We moved from primitive era to modern day practice of ophthalmology. It gave me a huge insight. There's so much that we can do to help people. Yeah, not only help them seeing, but a lot of illnesses can be diagnosed and they can be treated, which may not improve the quality of life, but it can save their life. My vision for eye care services in Fiji is to decentralize these services throughout Fiji Island. Not only decentralizing it here, but along the other Pacific Island countries, because I think if a doctor is sent to a very far island, they have to be in close connection with us as well, so that they can be, first is continuing medical education, so they have access to the resources, textbook, updated medication, so they may not stay in isolation and they do not update themselves. And I would know what would happen. It would be resistance to change after some time, and that's really dangerous, like for the doctor and for the patients as well, because with the changing pattern practice, I think we all have to update ourselves, keep learning, because we're not like computers, one thing written and it stays there. We have to keep learning every day a new thing, or the same thing for some people, and that's very healthy. She came with her husband holding her up on one side and the daughter supporting her. She was very pale and she had bilateral cataract, so we operated one. She was very dirty as well. She looks like she didn't have bath for some time, and her hair was all, and she was just wearing her old outfit. And then we did cataract surgery, and the next day she just started screaming. She was so happy that she could see. And then 1 week post-operative, when she came, she was so neat, clean, and she looked well. And that was really inspiring, like, and then after 1 month, and she requested for another one, and she wanted that to be done by me, so I just did that, and she's very happy. So every time I see her in town, she always says hello. An outreach program, or if a program to help people, we should help people regardless of their color, their religion, their race, and it's for everyone.